something happened to you tomorrow, would your family be okay financially? It's a tough question, but life, pension, health insurance helps answer it with confidence. Welcome to the podcast where we break down essential financial solutions to help you secure your future. Now, today we're diving into one of the most important and most used policies out there, health insurance. First up, Gary Sookdeo. Gary, welcome. How are you today?
I'm great. How are you?
I am fantastic. Well, I know we are here to talk about health. That is you are the king of health. You know everything or almost everything about health.
Let's say almost.
Almost.
Right.
Quite knowledgeable. How long have you been with Guardian?
I've actually been with Guardian 9 years now.
Okay.
Right. I'm a unit manager with Guardian Life. And, first of all, I really just want to express my gratitude to be here today.
Yeah.
Because I really like to take any opportunity that I have to share, educate, just a little part of, a little bit of knowledge onto others about any type of insurance. But of course, today we'll be focusing on that health insurance.
Right. And you seem pretty young. So what was the impetus to get into sharing that information of health with persons or wanting or having the desire to get into sharing health information?
Well, you see, health insurance is one of the most commonly used insurance. I would say it probably is the most commonly used insurance.
Okay.
Because it's a day-to-day type of insurance, right? Tell me, have you ever been by the doctor?
Oh, yeah, for sure.
And how are the bills?
Exorbitant.
Right. You see, now the thing about health insurance, right? As I said, it takes care of day-to-day needs.
Okay.
And hence it can actually help you enter this world.
Okay.
Before you're actually born, health insurance can be used for maternity benefits,
Okay.
for prenatal care. It can help your parents bring you into this world.
Yeah.
And while we're on the topic of insurance, once there is life, there must be debt.
Yeah.
And the thing about debt, right, again, just like life, it comes with expenses.
Yeah,
And
that's
health-
right.
Right? And health insurance can actually help you subsidize the expenditure with funeral expenses.
Okay.
Now, we spoke about health, we spoke about life, we spoke about debt, but everything in between also has health insurance involved.
Okay.
If you have dental work, how often do you go by the dentist?
Quite often. Some persons say, it's recommended maybe about 4 times of the year.
Just to do cleaning,
Correct.
checkups, right?
Yeah.
Health insurance gets involved there. We actually subsidize the expenditure there. If you have to get prescription medication, you have to go for a checkup, anything that involves medical bills, health insurance can offset the costing of it.
Okay, so it's extremely important.
It's extremely important, almost mandatory, I will say, right? Because health insurance takes care of everything financially. When it comes to medical bills, it always offset all of your expenditure.
And there are some persons you'll still have to somewhat force or impart additional information to them because the moment you approach them for health insurance, it may be a bit taboo, so they may be hands off on it. So I want to follow up with my next question in terms of the age, in terms of having to convince someone. They may say, I'm not of the age to look for health insurance yet. So at what age should someone really start with health insurance?
Well, that's actually a very interesting question, right? And I would say it doesn't have an age.
Okay.
I would say it have a timeline, right? And health insurance, you should have gotten it yesterday,
Right.
right? Because you can get insurance as soon as you're born. You can be added to your parents' plan,
Okay.
right? You can get insurance at age 30, at age 40. But really, health insurance needs to be purchased, as I said, yesterday. Because tell me, does it have an age to get ill?
No, it doesn't.
Right. Now, you can have bills when you're a child, just your
Yes.
parents will have to pay for them.
Correct.
Right? You can have bills as an adult. But what health insurance does is that it offset those bills.
Okay.
Right? Tell me, does illness discriminate?
No, it certainly doesn't.
Right? Now, we have doctors specialized to deal with children. We have doctors specialized to deal with heart surgeries. We have doctors specialized to deal with the elderly.
Yeah.
And I can guarantee you that one thing, no matter who the doctor is, no matter who the institution is, there's a cost attached to it, right?
Yeah, it is.
Right? Now, when this cost comes, health insurance can offset that costing,
Okay.
right? Just listen to the way it works, right? Just for an average, right? Health insurance will cover roughly between 70 to 80% of whatever the medical expenditure is,
Okay.
right? Out of curiosity, when was the last time you were by the doctor?
The last time I was by the doctor, maybe about 2 months ago. about 2 months ago. Yeah.
Right? Now, I don't know, but I'm hoping that you do have health insurance.
Yes, I certainly.
Right?
Well, even if I didn't, I know for sure I would be signing up after because
You
the
see?
information is pertinent.
You see, now you took away a prospect from me there. I could have actually done some business with you for health insurance. But, it's good that you're actually proactive
Yes.
rather than reactive, because that's the whole idea of insurance. You see, you can't get insurance when you need it, right? So, as you said 2 months ago, when you went by the doctor and you got ill, if the doctor asks you at that point in time, do you have insurance? Could you call me up then and said, hey, ring, I need to get a health insurance?
And no, because there's a process that goes with it.
Exactly.
Okay.
But at that point in time, we would have offset your bills.
Correct.
Right? And that's why I would say you should get health insurance no matter your age yesterday.
What about health insurance when it comes to the provision by employers? Tell us about that.
Okay, great. So I'm glad you asked that, right? Because this is something that a lot of employers can use to actually show their employees that they care.
Okay.
Right? Now, I wouldn't call any employer's name, right? But a lot of times you hear employers say, we care about our employees. We want to add value to our employees. We want to make sure they are taken care of. But tell me, do all employers show it?
Well, what I was going to ask actually is that, some employers may provide in the first instance, but what about someone who's employed at the company and were never approached? Is it that they can go to their employer and inquire about
Well, that depends on the group.
health?
So the way it works, right, is that the employer can actually purchase a plan or invest in a plan, right, for all of their employees.
Okay.
Right? Now, this would be a benefit that is given an option to take by the employee. So the employee will have an option. In some companies, that is an employer decision whether they make it mandatory or whether they make it optional.
Okay.
Right? But you see, the reason it's a good way for them to actually offset this and say, listen, right, this is something that we're going to add value to you, right? Let's just say we have a company with 100 employees,
Yeah.
right? And if you're dealing with 100 people, somebody is bound to get ill,
Yes.
right? But if one of them has a major surgery, let's say, God forbid, one should be diagnosed with a heart attack, right? Or cancer, which is very common these days, and they need to take care of medical expenditure, right? The health insurance can actually help with the bills, help offset the costing. But if the employer actually offer it, they could actually offer to pay part of it as well.
Okay.
Right? So it's not a case where, the employee will have to pay the full thing. Because the employer, no, that's a full employer decision.
Okay.
Right? The employer could say, hey, we're going to pay 100% of it. The employer could say, hey, we're going to pay 50% of it. But the option is there. So tell me, if you're an employee, right, and you're working for a company and you're coming to the company, or if you exist in the company and they now bring out the plan and say, hey, we really want to be able to take care of you on a daily basis, take care of your family, and we're going to be implementing health insurance, right? And we're going to cover the 50% of the cost of it, and these are the benefits, right? How would you feel?
Elated.
Right?
And relieved as well. I'll be
Right.
relieved also.
Tell me even more. If, let me say, 6 months later, right, you were to get ill, and you could say, my employer take this out for me, and now my surgery is 100,000, and I'm only having to pay about 20 to 30% of it. How would you feel as an individual?
Mentally comfortable. There would be a mental ease that will come with that, knowing that things will be taken care of.
Right? And more importantly, how would you feel about your employer taking the step to take care of you?
Well, happy that they are, but will be even more elated if they give me an increase. In his
Well, of course, right? I mean, nothing could really top an increase, right?
Right.
Because then you could take out even more insurance.
Yes, correct.
Right?
I like how you're keeping focus, Gary.
Well, I mean, that's part of the game, right? Keeping focus. You have to keep focus on whatever you choose to do in life.
Now, Gary, you mentioned as well that you have 9 years of experience
That's
or
correct.
more in the health insurance or in the insurance industry. Share with us, because I'm sure you have a few stories, but share one of those stories where the health insurance was really valuable to one of your clients.
Ooh. Okay, that's actually a great question, right?
Yeah.
And I mean, there are numerous cases, but I'd like to share one from not recent, but from the early days in my career, right? And it would have been, let's say, maybe the first 3 years, right? Well, I sold the policy before that, but it was within the first 3 years that this claim was paid.
Okay.
And the reason that this one actually stays with me a lot even till today, right, is because this person was just about 25 years old.
Oh, wow.
Right. She was very young. I mean, just like how you mentioned, when there is a good time to get insurance, right? When I actually spoke to this person about insurance, she wasn't ready yet.
Okay.
But she had that discussion with me and she said, listen, if you say it makes sense, I'm going to take that leap of faith and I'm going to invest in this.
Okay.
Because I can see what you're saying, but although I don't believe anything is going to happen, I'm going to make that investment just in case it happened.
Okay.
Right? And she made that investment. Now, after about 2 years, she called me one day and she said, Gary, what does this insurance really do? So, I mean, I laughed, right? Because I was like, I can't remember what we spoke about, right? And she was like, no, asking you a serious question.
Yeah.
What do you all cover, right? And as I started to go into detail with the conversation with her, she didn't tell me at that point, but about 5 minutes, she said, Gary, I was actually diagnosed with lupus.
Oh, wow.
Right? And I'm dealing with an individual just about 25 years old. Now, what that led to was both her hips needed to be replaced.
Oh, goodness.
Right? Now,
Okay.
imagine being 25 years old,
Yeah.
starting your career.
Not anticipating anything like that. to
Exactly. You're
happen.
young, you're enjoying fun, you're having a good life, you're building, you have plans for the future.
Yeah.
Right? And at that point in time, just like that, lupus and both hips need to be replaced.
Okay.
When I went to see her, she could barely walk. She was actually using a walking stick, right?
Wow.
And she told me about the surgery and the costing and the expenditure,
Yes.
right? And at that point in time, I told her, don't worry, we'll take care of it. Now, we later covered about 70% of that surgery.
That is fantastic.
Now, even furthermore, right? Her aftercare, she needed therapy, she needed medication, right? And we were able to, again, as I mentioned, offset the costing for that,
Okay.
right? And that person today is alive as well. She walks about like normal. You would never tell that she replaced both her hips,
Yeah.
right? And, that for me was not just a emotional thing, but an eye-opening thing. Because at that point in time, yes, I'm doing insurance. Yes, I'm helping clients invest in insurance. But I could actually say, wait, this could have happened to me. Because, yes, I'll newsflash, me and her
Yeah.
same age.
Oh, wow.
Right? We are the exact same age. So,
Yeah.
processing the claim, I could actually say, wait, this could have been me.
Yeah.
Right? So, I mean, I think that is a client I have that I'll be forever grateful.
Yeah.
About a year after the claim, she actually brought a gift to me. And, the gift was a plaque that says, keep calm and call Gary.
I like that.
Right.
I like that. Even when you mentioned that, she asked a question and something went into my head. She asked a question, Gary, really, tell me XYZ. And in my mind, I thought there was a level of trust there because there was complete trust in you to guide her, which is very commendable. So there is some level of trust when it comes to insurance and the person who is sharing that insurance information with you.
Exactly.
To kind of reassure you that what you're doing, that money you're putting in is fantastic and it will work in your favor. So I have to commend you for that, building that trust.
Thank you so much.
Now, before you leave, Gary, any additional information you'd like to share with our viewers?
Insurance is something that when you need it, you can't go and get it. And I think I
Yeah.
mentioned this to you
Yeah,
before.
correct.
Right? If you don't already have health insurance and you didn't get it yesterday,
Yeah.
then let's get it tomorrow.
Okay.
Right? Because you see, the people who are waiting for a heart surgery at this point in time, or the people who are waiting for any medical procedure,
Yeah.
do you think that they plan to be waiting for that procedure?
No.
They didn't plan to be waiting for that
Yeah,
procedure. The
correct.
people who are in a hospital bed right now, or the people who have medical bills piling up, the people who may have had to mortgage their home to get a medical procedure done, they didn't plan to do that. But life happens.
Yeah.
And sometimes we have no control of things as they happen. And what insurance will do, it will provide that protection mechanism
Yeah.
so that when life happens, because it will happen, right? I just can't tell you who and how and when it will happen.
And they always say life continues to life.
Life
Or
continues to life. Life, and as
yes.
they said, right? And when life begins to life and, it doesn't life in your favor, we can be there. We can be there as a person, as a company, as an agent, to help you navigate through life
Yeah.
as it lives, as you
Correct.
say. We can take care of all those unforeseen circumstances, unforeseen bills, everything that you didn't cater for,
Yeah.
but it just happens.
Gary, I want to thank you so much. Gary Sookdeo, bringing all the information, all the knowledge to us when it comes to health and really putting things in perspective for us. So we certainly do appreciate you and thank you so much for sharing with us.
You're welcome. It was a pleasure being here today. And, before I leave, I just want to share my information, right?
sure.
I mean, you can contact me at 296-9991. You can WhatsApp me. you can call, right? You can also reach out to my Instagram, Gary Sookdeo Insurance. You can find me on Facebook at Gary Sookdeo Insurance Limited, right? And you could feel free to shoot me a message, even if you're ready to start your policy, or you just want some solid, good, honest advice about what's the next step or how to plan. You can reach out to me and we can have that conversation.
So let's end things off with the plaque. What was the information from the plaque again?
The plaque said, keep calm and call Gary.
Keep calm and call Gary. I'll remember that.
And it's actually still in my office today. It's still in my office because, you know, it's one of those claims that stayed with me throughout my career. The year was 2021, and one of my very close clients was diagnosed with cancer. He needed surgery, and he needed surgery immediately. We were able to cover just about 70% of his medical bills. Today he's alive, he's well, and I was actually able to change that family lives by protecting their father, by protecting their husband. Allow me that opportunity to meet with you and your family so I can actually extend those same services. You can reach out to me at 296-9991. You can WhatsApp me, or you can call me. You can reach out to me on Instagram at Gary Sookdeo Insurance or on Facebook at Gary Sookdeo Insurance Solutions Limited. If you want to start your plans right away, or if you just want an opinion about where we can get started, feel free to touch base with me.
Thank you so much for your time, Gary, and for reminding us that health insurance isn't about fear, but about love, protection, and peace of mind. If this conversation gave you something to think about, or someone you care about needs to hear it, you need to share it with them. And don't forget to subscribe for more clear, helpful financial guidance. I'm Tamara Williams.
I am Gary Sookdeo, and we are Guardian Life.
I am, you are, we are Guardian Life.
It was 2019 and I had been with my health insurance provider for just over 3 years. Around that time, I was diagnosed with lupus and had started receiving treatment. Not long after, I began experiencing a persistent pain in my left leg. No matter how many x-rays I did, nothing showed up. Eventually, I was referred to an orthopedic surgeon who recommended an MRI. I remember thinking, thank God I have health insurance, because MRIs aren't cheap. After the MRI results came in, I got the news. I needed a bilateral hip replacement. Sounds expensive, right? That's because it is. Once the total cost was confirmed, I reached out to my agent at that time, Gary, and I was relieved when he told me my insurance would cover a significant portion, 70% of the cost, and I would only need to cover the remaining 30% as a copay. Gary made this entire process incredibly smooth. I simply emailed him the necessary information, and within a week he got back to me with a clear breakdown of what my insurance covered and what I needed to pay. That level of support brought such relief, knowing that I didn't need to come up with all of the money out of pocket. It gave me and my family a sense of comfort. The surgery was a success, and Guardian didn't stop there. Guardian Life didn't stop there. They covered my prescriptions, emergency recovery care, and even post-operative physiotherapy. To this day, I still have health insurance. No hiccups, no cancellations because I claim too much. No issues due to my diagnosis. My insurance works for me. Today, I proudly endorse Guardian Life and my agent Gary for helping me through the most difficult time of my life, making it as easy as possible. Not all superheroes wear capes. Some sell protection through insurance, and because of that experience, I made the decision to become an agent myself. I want everyone to feel that sense of comfort and confidence I felt knowing that they can rely on their agent when it matters most.
I am, you are, we are